to
What is
proceed
your
on
first
identifying.
purpose of male catheterization?
When is your date of birth? I'm going to do. Do you have any allergies for materials I need are already? Hello everyone, my name is Stella Martinez, and for today I am going to perform the proper way of inserting Foley catheter onto male patients. So first, what is the purpose of male catheterization? When a patient is having a hard time urinating normally, a urinary catheter is usually utilized, and it can also help perform specific tests and anti-bladder before or after surgery. So let's get started with the preparation before catheter insertion of our male patient. So first of all, we have to verify the order in order to proceed on identifying our patient and explaining to him the procedure we are going to do. So the materials I need are already set, so let's get started. So hi Mr. Park, my name is Stella and I'm gonna be the nurse working with you today. So how are you Mr. Park?
Good.
Okay, so I have some questions for you. What is your first and last name?
Gerapar.
When is your date of birth?
May 1.
Okay, so do you have any allergies for shellfish?
No.
Okay, great. So Mr. Park, I have an order of urinary catheterization. So that means I am going to insert a tube inside your urethra and it's gonna be sitting in your bladder. So it will help drain the urine that you have in there, okay? Only will take a few minutes so you don't have to worry. So after that, it is important to ensure privacy and lighting for our patient, which is already set. So let's proceed on hand washing and wear our gloves. Okay. So how are you, Mr. Park? Okay, we're good. So now it is time to position our patient in a dorsal recumbent position. Okay, so Mr. Park, let me clean your perineal area. Okay. Okay, now I'm gonna remove my gloves. Okay. Okay. It's about right. So now it is time to drape the patient. So I'm gonna be opening the kit in a clean bedside table. This. Okay. So now let's put on our gloves. Okay, so this is the drape. I'm gonna be placing it here with the shiny side down. Okay, so Mr. Park, can you raise your hips for me? Okay, yes. Okay. Right. We're gonna be using fenestrated drape to provide privacy for our patient, which is placed over the perimeter. Okay. And this is the 10 cc of sterile water, which is supposed to be attached to the balloon port. So let's do that. Just really making sure that it is attached very well. So let me move it here first. Okay. This is the sterile lubricant we're going to be using later. And finally, our antiseptic solutions, which are the cotton balls and sterile forceps. With these two, I'm not going to be using. Okay, we're set. So with my non-dominant hand, I'm going to slowly grasp the shaft of the penis, just below the glans, and hold this position throughout the procedure. So now I'm going to clean the meatus, which is also done 3 times with the use of antiseptic solutions. Okay? Okay. So now it is time for catheter insertion, but first, let me apply some lubricant for our catheter. So I'm going to insert this until I could see urine and go about 2 more inches. Okay? Mr. Park, can you take some deep breaths for me? Okay. I'm going to be inserting. Okay, I can see urine now. Let's go 2 more inches. Okay, you're doing great, Mr. Park. I'm going to insert the water. Slowly. Discard it after. Okay. Let's check. Okay. So that's about that. And for the drainage bag, it is best to move them in an unmovable side of the bed just below the bladder level. So let's do that. Okay. So we're good. So Mr. Park, how are we feeling?
Fine.
Okay. So I'm going to remove this. So I had already trashed the penetrated drape, which means the procedure is done, and now it is time to clean the used materials. Okay. Here. So I'm gonna be removing my gloves and assist the patient in a comfortable position again. So Mr. Park, let me assist you. Then after that, it is finally time for hand hygiene. And for the documentation, let's put the type and size of catheter and balloon. The amount of fluid inserted in the balloon. The patient's reaction to the procedure. The amount and characters of urine that is observed. The name of person performing the insertion, which is me. The time and date it is completed. So that's about my video, and thanks for watching.